Medical cannabis helps in certain conditions, and so those groups of people that are suffering from those conditions. Really, any opposition to that is just not based on evidence. I grew up in a very conservative household, and anything that drug-related, people that use drugs, songs about drugs were completely taboo. You know, they were bad people and end of the world. But that's just not the reality. And you know, I think that maybe the strategy that we use as parents for eliciting some fear in our children shouldn't necessarily be the reality of a tactic that's deployed as leaders for determining treatment or health care of patients. You know, obviously several other states had approved medical cannabis and starting to see some of the results. You know, in my line of work, we see a lot of people that suffer from pain or other conditions. And when you start learning some of the evidence that the medical cannabis has helped, you know, some conditions, not all, and so there's some cohorts of people out there that show benefit of that, and you're starting to read this in literature and hear, of course, anecdotal clinical evidence as well. It starts to, you know, come up on your mind and think, okay, well, maybe there's some benefit there. It's no different than any treatment of any condition. If, you know, you're a physician or if it's me and I'm aware of the evidence-based medicine that this is a treatment that can help someone, then that alone would be my guidance. And I see those patients, and you know, those patients are obviously nationwide, but they're in our state. And to know that there's something out there that can provide benefit to those patients, you can't help but have to advocate for that.